Hello everyone, welcome to my channel. My name is Roslyn, I'm a clinical nurse. In this channel, I'm dedicated to give health information on matters to do with health, be it physical health, mental health, reproductive health, environmental health, among others. In today's video, I'm going to give health information on hypertension. So, key facts about hypertension. Hypertension is also called high blood pressure or elevated blood pressure. It is a serious medical condition that significantly increases the risk of heart, brain, kidney, and other diseases. An estimated 1.28 billion adults aged between 30 and 79 years worldwide have hypertension, most two-thirds living in low and middle income countries. An estimated 46% of adults with hypertension are unaware that they have the condition, and less than half of these adults, that is 42% with hypertension, are diagnosed and treated. Approximately 1 in 5 adults, that is 21% with hypertension, have it under control. So hypertension is a major cause of premature death worldwide, and one of the global targets for non-communicable diseases is to reduce the prevalence of hypertension by 33% between the year 2010 and 2030. Blood pressure is the force exerted by circulating blood against the walls of the blood arteries. That is the major blood vessels in the body. Hypertension is therefore when the blood pressure is too high. Blood pressure is written as two numbers. The first is the systolic number, which represents the pressure in the blood vessels when the heart contracts or beats. The second one is the diastolic number, which represents the blood pressure in the vessels when the heart rests between the beats. So hypertension is diagnosed if, when it is measured on 2 different days, the systolic blood pressure readings on both days is above 140 and or the diastolic blood pressure on both days is above 90. There are modifiable risk factors and non-modifiable risk factors. So if we look at the modifiable risk factors, these include unhealthy diets, that is excessive salt consumption, a diet high in saturated fat and trans fats, low intake of fruits and vegetables, physical inactivity, consumption of tobacco and alcohol, and being overweight or obese. If we look at the non-modifiable risk factors, we have family history of hypertension, people who are aged 65 years and above and have coexisting diseases such as diabetes or kidney disease. Hypertension is also called a silent killer. Most people with hypertension are unaware of the problem because it may have no warning signs or symptoms. And for this reason, it is essential that blood pressure is measured regularly. So when symptoms do occur, they can include early morning headaches, nosebleeds, irregular heart rhythms, vision changes, and buzzing in the ears. Severe hypertension can cause fatigue, nausea, vomiting, confusion, anxiety, chest pain, and muscle tremors. So the only way to detect hypertension is to have a health professional measure your blood pressure, and having blood pressure measured is quick and painless. Although individuals can measure their own blood pressure using automated devices at home, an evaluation by a health professional is very important for assessment of risk and associated conditions. So among other complications, hypertension can cause serious damage to the heart because excessive pressure can harden the arteries, decreasing the flow of blood and oxygen to the heart. This elevated pressure and reduced blood flow can cause chest pain, also called angina, heart attack, which occurs when the blood supply to the heart is blocked and heart muscle cells die from lack of oxygen. And the longer the blood flow is blocked, the greater the damage to the heart. Heart failure, which occurs when the heart cannot pump enough blood and oxygen to other vital body organs. Irregular heartbeat, which can lead to a sudden death. Hypertension can also burst or block arteries that supply blood and oxygen to the brain, causing a stroke. In addition, hypertension can cause kidney damage, leading to kidney failure. Reducing hypertension prevents heart attack, it prevents stroke, it prevents kidney damage as well as other health problems. And prevention of hypertension can be done by reducing salt intake to less than 5 grams daily, eating more fruit and vegetables, being physically active on regular basis, avoiding use of tobacco, reducing alcohol consumption, and limiting the intake of foods high in saturated fats. Also eliminating or reducing trans fats in diet, managing and reducing stress, regular checking your blood pressure, and treating blood pressure and managing other medical conditions can also help prevent the blood pressure getting serious. So thank you for staying tuned. I hope this information was informative. See you in the next one.